My name is Emily Ratliff. I'm currently a student here at UCPI University in the RN to BSN program. And for my final project for my pathophysiology class, I decided to do a case study, create a case study essentially, on a woman that was diagnosed with ovarian cancer. The patient in the case study is a 43-year-old woman who was experiencing abdominal pain, abdominal bloating, and had reported that she had gained almost 5 pounds in the past 2 weeks. She had experienced this abdominal pain a couple weeks prior, but she owns her own business. She's going through a lot of stress, and so she just attributes it to the stressors and hardships of her job and doesn't go see the doctor. But eventually, the pain gets so bad that she ends up going to the urgent care. The physician at the urgent care told her that it was more than likely diverticulitis and that they prescribed her a course of antibiotics and told her that if it didn't get better after she had finished the antibiotics, to come back and they would see what else they could do. 2 days into the antibiotic treatment, the pain was getting worse. She was getting more short of breath. She couldn't do anything that she used to do. So she decides to drive to the ER to try to get some sort of answer. She knew that they could do more extensive testing, they could do CTs and x-rays and lab work and get it all there right on the spot. So when she got to the ER, they put her on a telemetry monitor, they took vital signs, and they drew labs. Her heart rate was regular, her vital signs were stable, so the doctor then orders a chest x-ray and an abdominal and pelvic CT to see if they could get any more answers. So once they completed these tests, the physician's assistant who was working in the ER walked in to review her results. The PA explains to her that her chest x-ray showed moderate bilateral pleural effusions, which she explained was contributing to her shortness of breath. However, her CT scan was a little more abnormal. So in her right ovary, they saw a large mass that was strongly consistent with ovarian cystadenocarcinoma. The bloating that was also causing the shortness of breath was malignant ascites, consistent with peritoneal carcinomatosis, which had resulted from a second nodule that was seen on the omentum, which is also known as the fatty tissue that lines the abdominal wall. So once she got her results, they discharged her from the emergency room. They put multiple consults in place, one of the most important being the woman's health oncologist, and they set up appointments as soon as possible to be seen to see what they could do about this. Ovarian cancer is commonly known as one of the top silent killers in middle-aged women. Because ovarian cancer can go untreated or even unnoticed for so long because the symptoms usually don't come about until the later stages. And in these later stages, it can metastasize to other organs, making it much harder to treat. Cancer is basically defined as a mutation of cells in the body that cause an overgrowth of these cancerous cells, leading to the formation of tumors and masses that can attach to basically any organ in the body. Now, different cancers present differently, they have different treatments, and they have different prognoses. It all depends on what organ is affected. In patients diagnosed with ovarian cancer, one of the most common lab tests done is the CA-125 tumor marker. The CA-125 tumor marker recognizes hormones that are excreted by tumors in the ovaries, but also in the fallopian tubes, in the endometrium, and in the peritoneal cavity. The Mayo Clinic reports that the normal reference range for a CA-125 tumor marker is between 0 and 46 units per milliliter. The CA-125 tumor marker is done serially with patients going through chemotherapy, so that way they can see if the levels are going down, then the patients are responding to the chemotherapy like they had intended. If it doesn't go down, then they seek other treatment options. Patients diagnosed in later stages of ovarian cancer, some experience malignant ascites. Another lab test that is done is the physician or the surgeon will perform a paracentesis, and whenever they do this paracentesis, they will collect the fluid that they drain off of the belly, and they will send it off and they will biopsy it to see how many cancer cells are present in the fluid. This is also great for the patient because it increases their comfort levels and it helps them breathe a lot easier. Along with lab tests, radiologic testing is used commonly in patients diagnosed with ovarian cancer. Dr. Forstner explains in one of her articles that CT scans are the main radiologic test used in patients with ovarian cancer. Because in these CT scans, they can see a large view, a broad view, to see if it has metastasized to any organs or any lymph nodes or anything of that nature. In ovarian cancer, there are many different treatment options that can be taken, all depending on how large the tumor is, if the tumor has spread anywhere, and what organs are involved. With chemotherapy, one of the most common treatments used for ovarian cancer is a surgery known as cytoreductive debulking. The Cancer Center describes cytoreductive debulking as basically taking out anything that is affected by the cancer. Therefore, any tumors, doing a total hysterectomy with an oophorectomy, and sometimes taking out the omentum or the lining of the abdomen, which is normally the first place that ovarian cancer will spread to. Article written by Dr. Mark Wakabayashi, the doctor explains that 20 to 90% of patients who go through this cytoreductive debulking surgery achieve remission, and in conjunction with chemotherapy has proven to extend a patient's life by years. Regarding prognosis and survival rates for these ovarian cancer patients, Dr. Holschneider wrote an article explaining all of this. So for patients who are diagnosed with stage 1 ovarian cancer, their survival rates are 93%, while patients who are diagnosed with the latter at stage 4, their 5-year survival rates are 25%. In this particular case study, the patient was diagnosed as stage 4, and the doctor had told her that once they take out her ovaries and her uterus and do chemotherapy, that she will be at an 85% remission rate. As a nurse, I think one of the biggest things is being an emotional support for our patients and also their families. As a 40-year-old woman, the last thing you want to hear is that you're diagnosed with stage 4 ovarian cancer, even though you went through all your routine testing, you were doing everything that you thought you should be doing, and somehow this still happens. Patient setting, one of the things that we can do as nurses is symptom management. This means providing patients who are going through chemotherapy antiemetics, helping them with pain control, educating them on fluid intake, also educating them that they're immunocompromised and showing them how to properly wash their hands and how to stay away from crowded areas until your white blood cell counts are back to normal. So that is my project on ovarian cancer. I just want to thank you for coming and listening, and if you have any questions, please feel free to reach out to me. Thank you. Bye-bye.